Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us once again. Our guest is Dr. Bruce Brown. He's a certified urologist and SVP of Medical at Dundrian Incorporated, joining us today to talk about Provenge. Welcome to the program, Dr. Brown.
Thank you. It's good to be here.
Now, I did mention that you are a certified urologist and Senior Vice President of Medical at Dundrian Incorporated. Give us a little bit more insight into what you do.
Sure. So in terms of my urology background, before I went into industry, I'm trained as a urologist, and I practiced urology in a community setting for 17 years. The past 6 years, I've been in industry, and the past 7 months, I've been working at Dundrian as Senior Vice President of Medical. I oversee our medical affairs, research and development, and regulatory functions.
We're here today to talk about prostate cancer. What is your experience with prostate cancer?
Sure. So I actually have a long experience treating prostate cancer, and I've seen it from multiple angles. For my urology career, when I was practicing, obviously I was taking care of many patients with all different stages of prostate cancer. And to be honest, at some points when the patients became metastatic or their disease had spread, for most of my practice career, it was honestly a little bit frustrating because we had limited options. We know that the food, so to speak, for prostate cancer is the male hormone, testosterone. So we could do several things to lower the male testosterone, and that would usually work for a period of time, and then the disease would continue to progress. And after that, until really the end of my practice career, there wasn't much that we could do that really significantly helped these patients. Turn that around to the time when I was in industry, starting at my time before Dundrian and at Dundrian, and now we have 6 approved therapies for metastatic castrate-resistant prostate cancer. So over the past 6 or 7 years, it's really a new era for these men and their families.
Now, this new era, as you say, of prostate cancer research and treatment, where does immunotherapy fall in this mix?
So immunotherapy and Provenge in particular, which is the Dundrian drug, is one of the approved therapies for metastatic castrate-resistant prostate cancer. One therapy, chemotherapy, was approved in 2004, and the next one to be approved was Provenge in 2010. Now, keep in mind, you hear a lot about different types of immunotherapy today for all different types of cancer with good reason. There's some great results. But in 2010, when we were approved, we were really a trailblazer because we were on the cutting edge and before a lot of the drugs that you've heard about today to treat lung cancer, melanoma, etc. So it was a different era and a different way for doctors to think about treating cancer with immunotherapy.
Is cancer different about prostate cancer, even in its advanced stage, significantly different now than it was, as you say, toward the end or even better, the beginning of your practice dealing with prostate cancer? And if it is different, is Provenge the result of that change?
Sure. So it is somewhat different, but it's different in a good way. The disease, we start to see some variant later in disease after people have been treated nowadays, and these were variants that we didn't see that often prior to 2012. The reason is, however, these patients are living longer. So by all these drugs, including Provenge, extending patients' lives, we're starting to see what the cancer kind of morphs into or changes into or mutates into at a later date. Some people would say that's a bad thing, but I like to say it's not necessarily a bad thing because in decades past, unfortunately, these patients would pass away because they didn't have all these treatments to extend their lives.
You know, mentioning life expectancy, what about quality of life as it relates to late-stage metastatic prostate cancer?
Yeah, that's a good point to bring up. You know, a lot of doctors who treat cancer have told me, I want 2 things for my patients, and this reflects what my patients want. They want to live longer, and they want to live better. So just because you can extend someone's life if the toxicities of what you're giving them, i.e. the drug, are so significant that the patient has no quality of life, it's not much of a benefit. Mm-hmm. And many drugs, including Provenge, have a very manageable safety profile. So you can give patients both those things. They can live longer and they can live better.
What about immunotherapy as a vaccine? Is this something that can be used to prevent cancer from developing in the first place, as far as prostate cancer is concerned?
So many people refer to our drug Provenge as a vaccine. It's probably more specifically a therapeutic vaccine.
Okay.
So it's something you're given after the patient has prostate. Not like typically what most of us know as vaccines are what we take as kids or give our children to prevent certain diseases. This is a little different way of thinking of it, but it does the same thing. It primes the immune system to do the work. So it's a different way of looking at things with immunotherapy, is that it's stimulating the immune system to fight the cancer versus conventional or older type of chemotherapy that was killing cancer cells as well as normal cells.
When you say it stimulates the immune system, are there other factors that need to be introduced in addition to Provenge, say things that generate white blood cells, or any other mechanism along with Provenge?
Right. No, there's nothing else that needs to be given. One of the good things about Provenge versus some other treatments is it doesn't do anything to your count of white blood cells or red blood cells. Okay. You don't need any stimulating factors to get those cells up. And obviously, if you don't have red blood cells, you can be anemic, which can cause trouble. And if you don't have white blood cells, you're more prone to infection. So no, Provenge in itself doesn't require anything else. It's got a couple things that it does. It targets it's programmed to target prostatic acid phosphatase, which is a ubiquitous protein found on prostate cancer cells, and then it has an immune stimulating factor. So it stimulates the body's immune system to then fight that tumor. So it gets you to the tumor, so to speak, and then it stimulates the body to fight it itself.
Now, I understand that Provenge has been given to roughly 30,000 men. Out of those 30,000, have the results revealed the ideal candidate for Provenge, and maybe the candidate who is just not going to benefit from Provenge?
So what we've seen is the earlier in the course of the disease in our labeled indication, which is metastatic castrate-resistant prostate cancer. The earlier in that spectrum of disease, the earlier it's given, the better it works. And that's for a couple reasons. One, the earlier patient in that spectrum or stage of disease has lower tumor burden, so immunotherapy can work better when the tumor burden is lower. Also, the further out you go, the worse the body's immune system is. So if you go earlier, the immune response, which is needed for Provenge, is more robust, and it can let the body do its work. And then with immunotherapy, it does take some period of time to work. So again, obviously earlier in any part of the disease, the patient has longer to live, and then the body can rev up its immune system and work against the cancer.
Dr. Brown, give us a website where we can go and learn more about Dendreon Incorporated and some of the therapies that you developed there.
Sure. Dendreon.com or Provenge.com. Both have information about Provenge and then Dendreon information in general about our company.
Thank you so much for joining me today here on Health Professional Radio. It's been a pleasure.
Okay, thanks very much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this show are available at hpr.fm and at healthprofessionalradio.com.au. You can subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm.